So I've just got off the NHS England webinar for community pharmacy, and I am furious. I've never heard in 17 years as a pharmacist a less connected, less informed load of nonsense in all my life. So right now, the thing that's jumping out at me is the death trap that is the NHS England plan around the use of volunteers. So I'm a district councillor, political activist in my own right, and I deal with volunteers all the time, and I can tell you, yes, they're very helpful, yes, they're brilliant, and I love them to bits, but they will also do what they want to do. They won't necessarily listen to instructions, and the thought of an army of people running into pharmacies trying to collect medicines on behalf of other people, not knowing what they're collecting, not, yes, supposedly signing up to some disclaimers to say that they've read some stuff, but do you know what? If you get medicine delivery wrong, you deliver the wrong medicine to the wrong person, people can die. People have died as a result of that. If you have somebody that doesn't understand the importance of an urgent delivery, for example, then you might get the right medicine to the right person at the wrong time. And that's going to be hugely problematic over the next few weeks. And that's not to mention the impact of having a load of random people coming in who are all posing infection risks into a pharmacy. It is ludicrous. I am furious. I do not understand who these people are listening to. There's quite obviously a massive degree of groupthink within the bubble there. I do not understand what the thinking is. This service deliveries have to be scaled safely. In order to do that, that requires a lot of management oversight from the pharmacy, which we don't necessarily have at the moment, but we will need to deploy. And to be absolutely honest with you, I do not understand how they think it's going to be a safe system. Now, Duncan Rudkin, who I've got a huge amount of time for, to be perfectly honest, did say that the responsible pharmacist won't be held accountable if you're following the process that NHS England have laid out. Well, legally and financially we might not be responsible, but morally and ethically, actually, we would be responsible. And I don't think that it would be appropriate to have people responding to an app turning up in pharmacies necessarily. We've got to be able to assure ourselves of the quality of the service that we're giving out. So that's the first thought, really. I mean, the second one is that they only answered the questions they wanted to answer, so there was not a single response about funding. They did want to talk about cash flow, and they couldn't give us any answers on that, but cash flow and funding are two different things. So cash flow essentially is making sure that that they can get money into our account so we can pay our bills. So what they're talking about there is essentially an advance against future income. So they're saying that effectively we can borrow from ourselves. That's great, but the pharmacy contract was already struggling before COVID. Already the number of closures was increasing and accelerating, and that is a policy decision that NHS England have actually been pursuing for a number of years. So, I feel absolutely categorically sick that nobody was taking any notice on the question of funding. Not a single penny has been committed to community pharmacy during this crisis. So to say that I'm incandescent that they wouldn't even acknowledge the question, for my own pharmacies, it's approximately £5,000 to £8,000 in the last 2 weeks that we've spent on additional staffing, on exceptional measures to help protect our staff. I am furious. Simon Stevens gave an assurance to all NHS providers. It was in his letter to all providers, I think it was around about the 17th of March, point 6F, which was that providers will be reimbursed for COVID-related costs, and they need to keep a detailed financial accounting of these costs. I can guarantee you right now that NHS England has no intention of, explicitly no intention of reimbursing the costs for community pharmacy. They're letting contractors who are trying to do the right thing walk into a massive financial hole. I do not understand how they feel that is fair or reasonable in the current circumstances. We need an explicit assurance that they will be forthcoming to reimburse reasonable costs. The whole thing, to be honest, was an absolute whitewash. I'm really disappointed. I don't have any faith here that anyone was actually listening to anything that anyone said. I'm trembling with rage at the moment. The callousness with which the question of PPE was discussed. So they're relying on the advice of Public Health England that pharmacies don't need to wear PPE when coming into contact with the general public, but just need to distance themselves. To be absolutely honest, that belies the lack of understanding and real-world experience of all of the people making the decision here. Public Health England could change their advice tomorrow. They don't have all the answers. They don't know what they don't know at the moment. So to hear that they're relying on that advice and that advice alone when making decisions about the health and safety of nearly 70,000 people in community pharmacy, I would say, that is unbelievable. Somebody really does need to ask some serious questions and to hold somebody to account here. On the question of, for example, the prescription charge. Again, a ludicrous answer that pharmacies are being asked to take card payments over the phone for prescription charges. We shouldn't have a prescription charge right now. It's an unnecessary bureaucratic burden at this moment in time. £330 billion has been pledged by the Chancellor. 4 months of prescription charges worth approximately 200 million quid to the Chancellor, and they're going to put the charge up on the 1st of April, a little April Fool's Day present for everyone. It is unbelievable that they are saying that they would get back to us with advice from Public Health England on the handling of cash. I don't know if these people don't care or they don't want to care, they don't understand. I just don't know. Who are they listening to? Why are they not listening? I don't know. All I know is that there are pharmacy teams out there who are doing an absolutely brilliant job right now, who are killing themselves to make sure that patients get what they need when they need it. And the leadership is so out of touch, so aloof, so ill-informed, that they are going to really seriously cause harm to both the public and to those teams that are trying their best at the moment. Good night, everyone. I'm really sorry I've had a rant there, but there's nothing else for it. Absolutely unbelievable.